viewers. Today we are going to discuss about novel coronavirus. 2019 novel coronavirus first identified in China and now it is spread worldwide. This virus was spread from animals at first and now it is getting spread from human to human. So let's discuss about coronavirus. CDC has identified some symptoms of coronavirus. Patients with coronavirus have reportedly had mild to severe respiratory illness with symptoms of fever, cough, shortness of breath. Symptoms may appear 2 to 14 days after exposure. Well, now what are the safety measures you should take to save yourself to be infected from new coronavirus and to save others to be affected from new coronavirus? So here are the safety measures you should take. World Health Organization has provided some safety measures. First of all, wash your hands. Wash your hands with soap and running water when hands are visibly dirty. If your hands are not visibly dirty, frequently clean them by using alcohol-based hand rub or soap and water. Protect yourself and others from getting sick. Wash your hands after coughing or sneezing, when caring for the sick, before, during and after you prepare food, before eating, after toilet use, when hands are visibly dirty, after handling animals or animal waste. If you are infected, then protect others from getting sick. When coughing and sneezing, cover mouth and nose with flexed elbow or tissue. Throw tissue into closed bin immediately after use. Clean hands with alcohol-based hand rub or soap and water after coughing or sneezing and when caring for the sick. Avoid close contact when you are experiencing cough and fever. Avoid spiting in public. If you have fever, cough and difficulty breathing, seek medical care early and share previous travel history with your healthcare provider. Practice food safety. Use different chopping board and knives for raw meat and cooked foods. Wash your hands between handling raw and cooked foods. Sick animals and animals that have died of diseases should not be eaten. Even in areas experiencing outbreaks, meat products can be safely consumed if these items are cooked thoroughly and properly handled during food preparation. Shopping in wet market in China and Southeast Asia. Stay healthy. Wash hands with soap and water after touching animals and animal products. Avoid touching eyes, nose and mouth. Avoid contact with sick animals and spoiled meat. Avoid contact with stray animals, waste and fluids in market. Working in wet markets in China and Southeast Asia. Stay healthy. Wear protective gowns, gloves and facial protection while handling animals and animal products. Remove protective clothes after work, wash daily and live at the work site. Avoid exposing family members to soiled work clothing and shoes. Frequently wash your hands with soap and water after touching animals and animal products. Disinfect equipment and working area at least once in a day. Stay healthy while traveling. Avoid travel if you have a fever and cough. If you have a fever, cough and difficulty breathing, seek medical care early and share previous travel history with your health care provider. Avoid close contact with people suffering from a fever and cough. Frequently clean hands by using alcohol-based hand rub or soap and water. Avoid touching eyes, nose or mouth. When coughing and sneezing, cover mouth and nose with flexed elbow or tissue. throw tissue away immediately and wash hands. If you choose to wear a face mask, be sure to cover mouth and nose. Avoid touching mask once it's on. Immediately discard single-use mask after each use and wash hands after removing masks. If you become sick while traveling, inform crew and seek medical care early. If you seek medical attention, share travel history with your healthcare provider. Eat only well-cooked food. Avoid spitting in public. Avoid close contact and travel with animals that are sick. We have questions in our mind: how coronavirus is spread? Can pets at home spread the new coronavirus? At present, there is no evidence that companion animals, pets such as dogs or cats, can be infected with the new coronavirus. However, it is always a good idea to wash your hands with soap and water after contact with pets. This protects you against various common bacteria such as E. coli and Salmonella that can pass between pets and humans. Does the new coronavirus affect older people, or are younger people also susceptible? People of all ages can be infected by the new coronavirus. Older people and people with pre-existing medical conditions such as asthma, diabetes, heart disease appear to be more vulnerable to becoming severely ill with the virus. WHO advised people of all age to take steps to protect themselves from the virus. For example, by following good hand hygiene and good respiratory hygiene. Are antibiotics effective in preventing and treating the new coronavirus? No. Antibiotics do not work against virus, only bacteria. New coronavirus is a virus and therefore antibiotics should not be used as a means of prevention or treatment. However, if you are hospitalized for the 2019 nCoV, you may receive antibiotics since bacterial co-infection is possible. Are there any specific medicines to prevent or treat the new coronavirus? To date, there is no specific medicine recommended to prevent or treat the new coronavirus. However, those infected with the virus should receive appropriate care to relieve and treat symptoms, and those with severe illness should receive optimized supportive care. Some specific treatments are under investigation and will be tested through clinical trials. WHO is helping to accelerate research and development efforts with a range of partners.